but on results day, my results were lost. When I signed into UCAS in the morning, and I was so nervous, and I was in clearing, and it said, you're in clearing, you don't have any of your offers. And I just remember thinking, oh my God, what am I going to do? I go into youth school, and they opened our school at 11, and UCAS opened at 8 or something. And so I remember looking at the page. I opened my results, and my grades weren't there, but my UMS were there. And so I remember being panicked. I don't have any grades, so I can't apply to clearing, and I don't have any offers.
Welcome, guys, to another episode. And today we've got Dr. Anam Chowdhury, who will be telling us about her journey into dentistry. She's just started as a foundation dentist, but she's also got a fresh perspective and experience being at Birmingham Dental School. So make sure to stick to the end, where we're going to end off by talking about widening participation to dentistry, something that I'm personally passionate about. So welcome, Dr. Anam Chowdhury.
Thank you for having me.
Yes, how are you today?
I'm okay. How are you today?
I'm good. Saturday morning, we're on Thursday. I get my days mixed up now with COVID and lockdown.
That's the thing. Just got to keep on top of all of the days. It won't be a problem when I start next week, but...
So, and I always like to start with, why did you want to get into dentistry? Why did you want to become a dentist?
Big question, isn't it? So I wasn't sure, like many 17, 18-year-olds, I wasn't sure what I wanted to go into from the start. Dentistry wasn't something that I wanted to do since I was like 4 years old, or I didn't have a lot of role models so I'm the first dentist doctor in my immediate family. And so I knew that I wanted to do something science related. I used to always excel in biology. I'm a people's person, and so I would get on with a lot. So I knew that I wanted to do something with a lot of interaction, science based. And then my dad, he's immigrated from Pakistan, and so he always had the dentist, lawyer, doctor mentality. So he would always push us. And so when I got into year 12, I was presented with so many options. One of which was dentistry, because I had a cousin who was she was in dental school in Leeds. So she discussed it with me. Then I went on my work experience, tried to get some work experience, couldn't find any work experience. Went to absolutely every dentist with a letter about why I wanted to do it, couldn't get in, finally found some work experience. Yeah, and then when I went to my work experience, absolutely loved it. Yeah. But yeah, that's what made me then think, okay, I could do dentistry.
And is your family within healthcare? Have you got siblings that are working within healthcare? What's that like at the moment?
So I'm the oldest daughter, but I've got two younger sisters. I've got one older sister who's a lawyer, and I've got two younger sisters who are doing pharmacy.
Okay, so doing very well.
So I was opening our own healthcare. So I was the only one that wanted to do dentistry or medicine, but we were kind of steered towards that way. But I just was so lost. I didn't have anybody to really look up to.
Yeah.
Even in my school, there was really nobody that could.
And looking back to when you applied to dental school, what would you say were some challenges in applying to dental school?
So a bit of background. I came from an inner city state school, where the rates of attainment weren't typically on the high side. We had a few medicine applicants in the year above. In my year, we had one medicine applicant. I was the only dental applicant. And so when I took my ASs, I got Bs and Cs. And so that added on to the fact that I was from a school where I didn't have a lot of dentistry applicants. I was the only one. And then also my own self-esteem, that can I actually do this, because I don't see anybody around me that's doing this. And so that was one of the challenges that I had to overcome. And then it was looking at my grades. And then I remember at the end of year 12, I was just so confused. I didn't know what to do. My grades, I knew that I was always told that we need A's to get into dentistry, you need A's to get into dentistry.
Yeah.
But I didn't have the A's. And so I was told by my school that, dentistry might not be the right career for you. Maybe to go for something less competitive. And so I had that in the back of my head. But I knew that I wanted to do it. So at the end of year 12, I decided that I would take a gap year and not apply for that year because I was just so confused that I didn't know whether to apply, but I knew that I had low chances. And that's where I got into like widening participation, and that's where I was introduced. And that was the first thing.
So what grade did you get by the end of your A levels?
So I ended up with 3 A's, but that was because, so in year 13, at the end of year 12, I started to get quite ill, and so I had to defer my A levels. So in my gap year, I did my A levels and I applied. And I think that was when I think the year 12 was such a big wake-up call for me, because A levels were a completely different ballgame to what I was used to. GCSEs were always quite plain sailing. A levels were different. And then on top of that, the competitiveness of the degree and getting in, the stress, not having anybody, and my mental health kind of took a back seat. I was getting really anxious, and then I decided that, let's take a year out. Nobody else was taking a year out at the time. And when you're 17, 18, 1 year seems like such a long stretch of time.
It does, doesn't it?
I'm so glad I took the year out.
Yeah. So actually speaking on that a bit longer, because recently we've had the whole situation with results and people getting predicted lower than what they should have been predicted or higher than what they were actually getting. What are your thoughts on that and thinking about, how your A levels went?
I think when I heard about it, I was completely shocked. But then I was thinking, looking back on it, I think I was so naive to be so shocked, because it's not like these students are disadvantaged not only by our system, as we've been shown by our A-level results, but they're disadvantaged and they're not having the conversations at the dining room table. They're maybe from a school that has low higher education attainment. They're not seeing like the role models around them. They've been told that they need A's. And that was I was really disappointed to see. And the fact that they weren't allowed to take the A levels or to have a chance to prove themselves, and their postcode was put into an algorithm to give them an imaginary grade. That's what's really upsetting. But it's amazing how the government issued a U-turn. The issue is, it should have never happened in the first place, especially for degrees like dentistry and medicine, where you've got a cap, where it's still restricted.
Yeah.
But
So let's talk to the people that maybe didn't get the grades. So you didn't get the grades initially. Why didn't you stop there?
It was, so by the time that I got on with MIS, I was doing widening participation. So what widening participation is, I know we're going to talk about this later, so I'm going to try and keep it short, but it aims to represent groups that are underrepresented. So in dentistry, that's mainly like our Black students, our students from lower socioeconomic backgrounds. And so when you do a widening participation program, they give you an offer, and it's called a contextual offer. It can be 2 grades lower than what a normal offer would be. So for dentistry, and typical offers, A star, AA, your widening participation offer or your contextual offer would be ABB. And so that was the thing that I thought, what, if I can get those grades, and even if I don't get those grades, I'll do an undergraduate, I'll go into dentistry. Life is so long, but at 17, you just think everybody else is going into their degree straight away. I need to know what I'm doing. I think I had that. I had my why so strong, and I was like, okay, I'm going to try.
Okay, so you were committed to making dentistry a reality, and initial grades weren't going to stop you. So, okay, how did you then choose the dental schools? Was it just on dental schools that were part of widening participation? How did you choose which dental schools, and what was your application process like?
So I looked at schools which historically accept a lot of widening participation students. So I looked at like we made freedom of information requests and everything like that. Because at the back of my head, I was like, oh, I'm going to be different to everybody else. I'm coming in maybe with a lower offer. normally dental applicants come from higher socioeconomic backgrounds and really different. So I looked into that. I applied for schools that were on the Widening participation scheme. So I was part of something called Realising Opportunities. And that's a scheme that's part of 16 universities, many of which offer dentistry. So I decided to go from Manchester, Birmingham, King's, and Sheffield.
Yeah.
And so King's didn't offer me a lower offer, but they gave me consideration for the extended dentistry program. But Birmingham did, and Manchester gave me a lower offer as well.
Okay. So would you apply through UCAS in the same way as everybody else, and then they automatically put you in that, or do you apply for something specific?
So you apply for the Widening participation scheme straight away. So when you go into year 12, if your school's eligible, if you come from a postcode in which there's not high progression into higher education, if you're the first generation to go to university, if you're a carer, there's loads of eligibility criteria. But if you apply for that, you do a program. You have to do an essay about your chosen topic. You get given a mentor, and you get given interview support and everything like that. Then you apply through UCAS. But when you apply through UCAS, you have to put in that you're a Widening participation member, and then that flags it up on the university system. And then once you've actually passed it, you have to come up with a certificate. You have to prove that to the university that you're committed, and then they allow you to progress forward.
Yeah.
And then they'll give you the offer.
All right. So I was never really aware of this pathway like this. Yeah. Who brought it to your attention?
It was actually my teacher that brought it to my attention. So he told me to go and apply to it. Birmingham is very good, in fact, in the outreach. So they attend all of the inner city schools. They attend and they look at the demographics of the people that they're admitting. And so he said that he was aware of Widening participation. He doesn't really know a lot about it, but I spoke to my head of sixth form. He was also aware of it, and then that's how I got into it.
All right.
Because loads of students don't ever get told.
So we'll definitely get a little bit more into that near the end. Mm-hmm. Did you have all your interviews? Did you have some of the interviews?
I had applied to 4 universities, 3 interviews. Sheffield rejected me. I didn't really want to go to Sheffield, to be honest. I'm not just saying that because they rejected me, but I wasn't sure about Sheffield. So they rejected me straight away. I never even asked them why they rejected me, but Manchester gave me the offer, King's, Birmingham gave me an offer as well.
And looking back, why do you think that you were successful to get those 3 offers?
I think, so I would look, practice. I would practice with strangers. I would always struggle with public speaking. It's something that I still struggle with now. But I would practice with strangers, and I thought if I could speak in front of strangers and if I can explain and get across my motivation, then I can do it in front of anybody. I can do it in front of like these scary dental admissions tutors. So I think that was it. And just coming across as caring, coming across as friendly. What I found really helped me was I talk really fast and I get like word vomit. So when I would go into interviews, which is what I did with my foundation placement as well, when I go into interviews, I would speak to the person that was registering me and just get it all out. Just say, how are you? Get it all out and then sit and then speak. MMIs helped me a lot because you get a full stop at the end of it and you get to reset yourself.
Yeah.
So I think that's why I was successful.
And in terms of then picking Birmingham, what made Birmingham stand out? Why was that the special one out of the 3?
Birmingham kind of chose me. So I knew that Birmingham's home, new dental school, just new dental, the hospital just being built. We were one of the first people in the dental hospital. So I remember that's what appealed to me the most. I would say good outreach program. I knew that I could get involved with Widening participation, and I was comfortable around the area. I did apply. I firmed King's, and Birmingham was my assurance. But on results day, my results were lost. So I went onto. When I signed into UCAS in the morning, and I was so nervous, and I was in clearing. And I said, you're in clearing, you don't have any of your offers. And I just remember thinking, oh my God, what am I going to do? I'm going to use school. And they opened our school at 11 and UCAS opened at 8 or something. And so I remember looking at the page, I opened my results and my grades weren't there, but my UMS were there. And so I remember being panicked. I don't have any grades, so I can't apply to clearing, and I don't have any offers. And I remember our exam teacher, she's in charge of all the exams. She was like, oh, I need to go by 12. And I was like, what do you mean? Like, I don't have anything. And so I sat with the same teacher that told me about widening participation. I sat with him, we calculated the grades. Yeah. And then I thought, I've got the A's, I've got the grades. I couldn't speak to the exam boards myself, so he rang the exam boards for me. Rang the universities. King said, we already filled up our spaces, but if you get your place, we'll give you a place next year. And Birmingham were like, we still have spaces for you. I got my grades, went to Birmingham.
Wow.
So glad.
That's a first. Your grades were actually lost.
Lost.
Wow.
Only happened to me.
So do you think that was time dependent? So if you hadn't got to Birmingham as quickly as you did, do you think that you could have lost the opportunity to start in that year?
Yeah, definitely. Which is why I say to dental applicants as well, sometimes dentistry doesn't historically go into clearing, but if you might be on a wait list, so it's really important. It doesn't matter how confident you are, because I was very confident, but things like this happen. So it's very important that you have like your list of admissions tutors, a list of phone numbers, and you have somebody there with you. And so you go straight away and you go and call them. And so you're not confused and you're not on the internet looking up the numbers. Yeah. But if I wasn't that fast, I don't think I would have got a place.
Yeah. So were you living around Birmingham at the time?
Yeah, I was living at home. So I stayed at home throughout my dental degree.
Okay.
I'm so glad I did.
So you'll have a unique experience then, staying at home whilst going to dental school. Because a lot of the times people decide to move away from home. I guess your plan originally was
too. And my parents were very happy also. It was a balancing act, yeah.
Yeah.
But it was good. You get to get the best of both worlds. So I wasn't held back on doing anything or going out or doing when I came home, I had my meals cooked for me.
Yeah.
Which is
okay. Best of both worlds in a way.
Yeah, I had the best of both.
So talk to us about the experience at Birmingham Dental School. How was that from first year all the way to final year? What was your experience?
I would say Birmingham's quite academic in its, when I attended, it's quite academic. So they almost treat you to be a medic and then a dentist towards the start. So with your first and your second year, your preclinical, first years you're spent in medical school, 1 day in dental school. And in dental school, you cover stuff about the GDC, you cover professionalism, but in the medical school, you're doing your foundational sciences, you're doing digestive, renal, endocrine, cardiovascular systems, biomedical science.
Is that together with medicine students or the science students? How did that work?
You're by yourself, but you're taught, you're on your own as a year group, but you're taught by the medical lecturers. And there's a lot of interprofessional learning at Birmingham. So we had workshops with the pharmacist as well, with the medic. So there's a lot of focus on that.
Okay, so that was more of the first year, and then going through the different years, how was that?
Yeah. So second year we focused on dental. So that was we have a module called craniofacial biology.
Say that again.
Looks in the anatomy of the skull. You have to look at everything from here upwards.
What was the module? Was it craniofacial?
Craniofacial biology.
Okay.
And so we had to do a prosection. We had a prosection test. We had to do a viva, and you're sitting in front of a doctor or a surgeon. They pick up a skull. They point at any hole. They tell me what goes through here. What bone is this? If it's like a sphenoid bone, what bone is this? And then when they find out you're comfortable with it, they move on to the neck. What is this? So that was the focus of second year was very, again, sort of medical, but bringing in, when we had our oral biology, we had a bit more dentistry, but everything was, again, very theoretical. Yeah. Towards the end of second year is when we started doing phantom heads, and we actually got feeling like we were dentists. And I think that's what I struggle with in first and second year, because in the middle of second year, I was like, okay, I want to drop out because I don't know, just felt so overwhelmed by the workload.
Yeah. What was it about the workload that felt overwhelming?
It was just constant, because I didn't realize how much time has to go into dental school, how much it's your life for 5 years, and it's very difficult to then look forward and see yourself as a dentist when you're not doing any dentistry. At the time, I hadn't seen any patients, and I remember going and sitting down with my welfare tutor, who's now the head of school in Birmingham. I remember saying to her, "I don't think I can do this. This is so hard. Everyone else is achieving so much more than I am," because you have that mindset as a dentist student, competitive. You've gone from like one of the best in your school to being average in dental school. And I remember sitting there and I said, "No, I don't think I can do this." And I remember her saying to me, "No, wait, you haven't had your patients yet. Go and have at least a session with the patients." And then when I was in third year, when we got started patients up, and I was like, okay, now this is like more like it.
So what was it about seeing patients that changed it for you?
I think just the rewarding, I think it was just so rewarding to see patients and having patients come. You probably have that all the time when they come in, like, "Oh, I hate the dentist." And you're like, okay, great. And then seeing them at the end of a treatment, making a difference, not just, I understand by that time, by third year, I had a good understanding about the theory, but I hadn't done anything practical. So doing something practical, doing the first cavity prep, even though it was quite bad, but even doing that, getting started.
So explain that just for people that aren't in dental school yet. What do you mean by doing your first cavity prep? What's that all about?
So so throughout dental school, you have to do certain procedures. And at the start, you always practice on a phantom head. You practice on the phantom head, which is like a dummy. And you practice, so like a cavity prep is something when a patient has decay and you're going to remove it, and you're drilling into the tooth, you're removing everything that's diseased and leaving something that's healthy, and you're going to fill it up. So that we practiced that on phantom heads loads of times, and it was the first time doing it on the patient and taking them out of pain. That was one of the best things, taking the patient out of pain, doing something, and then patching them all back up again.
Yeah. And how much, so when you started seeing patients, how much time was actually allocated to seeing patients and how much time was in lectures?
So that's another thing. I feel like we could have had more clinical exposure, which is what we've given. That's the feedback that we gave to the other years, and they have implemented more clinical exposure. But in in third year, you're on clinics for a morning and an afternoon, just a day in clinic. But in Birmingham, you're not paired with anybody, so you have your own trainee nurse. Your clinical time is your own clinical time. And I know with other universities you're paired. So that's third year. With fourth year, your days increase, your 2 days on clinic. And with fourth year, they start doing specialty clinics as well. In third year, you're doing general dentistry, you're doing new patient exams a lot, you're building up your patient base. In fourth year, you're doing your specialty, so you're doing, you do ortho, oral surgery, pediatrics. You start that one in fourth year. And then fifth year, which was my favorite, that's when you end your specialities and then you start your general dental practice, and you do more complicated, and we did a session in sedation, which is dealing with anxious patients. So by fifth year, you're developed.
Yeah. Would you say the number of exams that you were doing went up each year, or you were doing the same number of exams each year? Was the workload similar?
I think in first and second year, it was a lot of them. So if the format of the exam kind of changes, you do have similar number of exams. But first and second year, you're doing written mostly, or oral vivas. In third year, we were doing, again, third year was the least amount of exams, I would say, because you're getting started with the patients. Fourth year, again, you're doing mostly vivas, but more practical, like OSCEs, which are like clinical exams. So it's similar to an MMI. You have to do something clinical at every station, whether that's writing a referral letter, prescription, or talking to a patient. And then in fifth year, fifth year you have finals, So we had our finals in February, so we missed all of the, which I was so happy about. We did our finals in February, and that's like a big, everything comes together, and you do your finals, and you have written finals and practical finals.
Yeah.
Yeah, I think for me, it slightly became a bit more easier with exams, but I think that was because you get used to it.
After 5 years, yeah.
After 5 years, you get used to it, yeah.
Yeah. And what was it like in terms of just connecting with other dental students that have come from all over the country and, making friends? Because I think that's going to be a major thing for people that are about to start dental school or looking to get into dental school.
Yeah. And I guess with the people that are about to start dental school, the fact that everything seems to be virtual, freshers is slightly reduced. That's probably another worry that they have. But honestly, you make friends in dental school really fast because you're with the same with the same year group. Your year groups tend to be quite small. Our year group was around 68 students.
Okay.
And so my tip would just be friendly with everybody. I learned so much more from sharing my notes than from withholding all of my notes. I made so many friends, and your friends are not necessarily people that you talk to in freshers, but you develop your friends. And I think just being open, I was able to make such amazing friends, and we all helped each other, and sitting before an exam and panicking, and then coming out and talking about it. Yeah. But I did make lifelong friends, I hope.
And then now, you've just recently finished dental school, and then the next step was becoming a foundation dentist. What was that whole process like with COVID and the lockdown, getting ready for foundation? Yeah.
So we had done our written exams. We were pulled aside out of our clinics. We were told to come in early, and we were sat in the lecture room, and they said to us, there's a pandemic, this thing called coronavirus going on. We don't know what's happening yet. We'll try and keep you informed, but this is probably one of your last clinic sessions. You can't use any aerosols. Try and get your finals patients if you need to try and take pictures. And it was just panic. I didn't get my finals patient in, but I was able to, I had study casts, so I had pictures from before. So it was just panic. Everyone's trying to get their lab work done. No one's allowed to use aerosols, and no one's allowed to do any procedures. We don't know anything, so it was just the unknown, and the dental school didn't know what was going on that much at the time. Then we were told that our practical part of our finals would be done online, and they organised that really, really well to their credit. They did. So we had a little quiz. It's like a Canvas quiz, or we were presented with a case, and it has to be quite a complex case. It has to range around 3 different specialities, and you're presented with a case, and you're presented with a series of questions. You're presented with X-rays, photos, and a bit about the patient's history. And you have to look at the X-rays, come up with your diagnosis, come up with your treatment plan.
Yeah.
So it's a bit more difficult doing it without a patient in front of you as well, because you can't ask them the questions. The radiographs are always a bit scratchy. So that was but we all graduated. We were white glove, yeah.
Yeah.
And then we graduated online.
Fantastic. Well, fantastic that you all graduated. Maybe not the same experience in terms of having family and everybody's at the same location. And now that you finished dental school and started your foundation year as a dentist, what things are on your mind? What things are you having to think about?
So I think it's a very different time, but because we're lucky because we don't know any different. So I think everyone's in the same boat, but we are having to be redeployed. So a lot of foundation dentists are having to be redeployed. So what that means is that we might not necessarily be in the practice. We're going to be moved to areas that need us. So I'll be working in public health in Worcester. So I'll be helping the public health consultants there. I've got some friends who are doing vaccination, flu vaccines over in Bradford. So it's a bit different. 2 days in practice, we're not seeing any patients because I haven't seen any patients since March. That's my big anxiety. Yeah. I haven't seen any patients in March. I didn't get to finish, which is my biggest thing, that I didn't get to finish the treatment. Because you go to dentist when you see this patient, and I had patients from 3rd year, And I was finally getting to that deliver the crown and deliver the bridge, and it just got completely thrown out. So that's what I'm slightly anxious about. I'm really excited to finally begin.
Yeah. Have you got to meet the staff at the practice you'll be working at?
I was lucky, so I was allowed to go in for like a socially distanced visit only. We weren't allowed to go into any practices beforehand. We were given a list of practices and their bio and 2 lines about the practice, and you had to rank the practices. Normally, foundation dentists, they can call, they can go and have a look at the practice and then rank it, but we weren't told any information. I went in and managed to meet everybody, but I was wearing a mask, so I don't remember what some of them looked like because it was just so covered. But yeah, we've tried, everything's virtual, all our study days are virtual.
Yeah.
Yeah, it's a different experience, but
Yeah.
still grateful.
I guess the positive is you still have many decades of dentistry to come. So there's no need to rush it at the beginning. I really wanted to ask you about widening participation, because that's something that I saw. Well, your page that you started on Instagram is all about widening participation. So why is that a big thing to you?
For me, it was when I was going to dental school, I would always come across, I would mentor applicants, and I would always come across and they would always say to me, oh, I wish I knew about this earlier. I wish like there was somebody. And when I was applying for dental school, I used to spend ages and ages on on student room. And I would just look, and these dental students are getting A's and they're getting offers, and I didn't see anybody that was like me. And even if they were like me, they were too afraid to say, "Oh, I got into dental school with lower grades," or "I resat." Which is why your page is so amazing, because I've watched your YouTube videos, and I didn't get into dentistry first time. I resat, and that's bringing raising awareness. So I think that was my main thing, to raise awareness, to educate dental professionals as well. Yeah. So I feel like we are now in the position to help people, and there's not a lot of research about dentistry and widening participation. There's a lot about medicine and widening participation. We just don't know. And then the A level fiasco and all of that. And then I was just like, I don't see any page that's specific to dentistry and widening participation. I see it's always an add-on to a medical page. And I was like, okay, this is what I want to then go into.
Yeah. And do you find that there are many people from Pakistan or with the heritage from Pakistan that are in dentistry in the UK?
Yeah, there's a lot of Asian applicants. Actually, there's been an influx of Asian applicants, and but there's a lot of people that come from higher socioeconomic backgrounds and that are now in dentistry. Yeah, probably because they've got a dad like mine pushing them. But yeah, there was not a lot of people that were saying that I went through this application. This is how I got in, and this is what I use, and this is widening participation, and that's why.
Yeah. And what are you working on at the moment, or in the future? What do you hope to be working on to help with widening participation?
So I think for me, it's trying to educate dental professionals about how they can help, trying to get the work experience. I was looking into starting a mentoring program for these students, linking them up with students that were like me. And so I'm trying to set that up, just going through that logistics of that, trying not to be lazy, pushing myself. And then also trying to get stories about, and trying to showcase and pass the mic on to students that were underrepresented, that had unconventional routes into dentistry.
Yeah.
That's what I've been working on, and then also trying to get some foundation dentistry posts in there. Yeah. But yeah, it's really exciting. So nice to have support as well.
Fantastic. And I mean, looking back to when you were applying, what key tips and advice would you give to somebody who might benefit from the route you took, or somebody who just might think, I'm not smart enough, or I haven't got the resources to be able to get into dentistry?
I would say start early as possible, and also I would say start early as possible and research. Most universities, well, all universities, and especially dental schools, they have widening participation and outreach programs. So going onto their website so go onto their websites, have a look, ask to speak to the dental students they are really helpful. Most dentists will want to speak to. There's so many accounts that weren't present when I was applying, and be confident. If you're not confident, fake it, and just go in and put yourself out there, and just decide. Like what I did was I was saying that I want to get into dentistry, and it doesn't matter how long it takes me, but I'm going to try and get into dentistry, and have your why at the back of your mind and go for it. And there's no difference between you and anybody else. And even if you get a contextual offer, there's still no difference between you and anybody else. They've seen potential in you, and that's why they've admitted you, and that's why. And you should see the potential in yourself as well.
Did you feel a bit different having come through the widening participation route when you were in dental school? Was it something that you felt like, I'm a bit different, or did it not matter at all? Was it not even a conversation?
It was. I did feel different. It's like the imposter syndrome, isn't it? Everyone talks about that. You feel like you don't belong there. That you don't see. I didn't see a lot of students that were from state schools. Most students were from grammar schools, and there's different experiences. And I heard about the support that they gained throughout the application. You know, having teachers that knew about the application process is so instrumental, or having a mentor, and how their dad got them work experience in a maths facts and in a maxillofacial surgery, and how they got to see such cool operations. And you feel a bit disheartened that I didn't get given those opportunities, but then that's what then spurred me on to create my page. So I did have that. I felt like these students, they're amazing, they're straight A students, and then now looking back on it, it doesn't matter. With dentist school, it's just your hard work at the end of the day, and it's your passion.
Yeah.
And if you have it, it doesn't matter.
Yeah. I had a message recently from an aspiring dentist, and they were their question was, do A levels matter when you're applying for a job as a dentist?
I had that. I had one of those. Yeah, that's the thing. I was saying that the A levels are kind of GCSEs are stepping stone into getting to an A level subject. A levels are stepping stones to getting to university, and then after that, nobody sits there and says, "Oh, I had 3 A stars," and it doesn't matter. And I always try and explain to young dentists as well, or dentist students. I try to say to them, your patient's not going to see your amazing occlusal filling. They're just going to remember how you feel. They're not going to come back because you do amazing fillings, or your photography is really good. It's the way that you communicate. If you can come across like that, it's almost like the academics don't matter as much as your actual personality and the way that you come across with your patients.
Yeah.
But
that's good.
But at that time, you just believe that your grades are the be all and end all, and they're just stressful.
Yeah, they're just a tool to get you into dental school, and after that, they're not really that important. What would you say dentistry is to you?
Oh, that's a good question. I think it is my passion, but I think it allowed me to then look beyond my circumstances, then progress to something. Dentistry is always seen as when we were growing up, dentistry has always been seen as a white middle class male profession, and getting into it, I just feel so grateful that I was able to give in. And now I see, now that I'm in dentistry, there's such a supportive, motivational, it's such a supportive, motivational profession. But yeah, it is more than a job. I would say it's more than a job. If you're going to dentistry for the money, don't go in for the money. But yeah, it's really good, and feeling really grateful that I was in. Yeah.
Awesome. Thank you to Dr. Anam Chowdhury for taking her time to share with us her dental journey. If somebody wants to get in touch with you, how can they do that?
Yeah, so I've started my dental Instagram page. It's called Widening Access to Dentistry. My DMs are always open. Happy for you to drop a message. Yeah.
All right, I'll put that in the description as well, so people can get in touch. But no, thank you for coming on today, and I'm sure we'll continue to talk going forward.
Yeah, thank you very much.
Guys, make sure to subscribe turn those notifications, and watch the other videos as well from other dental students, from other dentists. That will help you within your process of getting into dental school. And whilst you're in dental school, just hearing about other people's experiences as well. So see you in the next one, guys.